Words can move us or keep us paralyzed. Our choice of words dictate our thoughts and in turn dictate our actions. There are a few words commonly used today which have become taboo or socially unacceptable due to their negative connotations. These words are never or rarely used in normal everyday conversation. In the world of personal development and growth, the C word, the N word and the F word stand out as prominent taboo words. I cannot do this. I will never succeed. I am a failure. There is another word that is a staple ingredient of so many conversations and utterances that can be so powerful in its effect. It can counteract every other word that has come before it. This word can hold you prisoner and stop your progress in its tracks. I'm speaking of the B word. What is alarming about this word is that so many people use it to justify their inability to do something, their procrastination, apathy, laziness, anger, greed, lack of responsibility, and even at times their criminal acts. This B word justifies the C word, assists the N word, and leads to the F word. The B word I'm speaking of is but. Do you know any but people? I can hear them now. I could lose weight, but I could have got fit, but I would have done that, but I know it is wrong, but even the flow of conversation it comes out. I really agree with you, but I call these individuals butters people. Butters people justify everything they do and do not do with a but. So much so that it becomes synonymous with their entire life and conversations. If a butters person hears this message, his or her first thought would be, yeah, but. I would say, no buts. But, they would say again, but nothing, I would reply. But what about this? And but what about that? They would continue. A butters person would remain persistent in his or her never-ending quest to find justifications as to why their life and circumstances are the way they are. A butters person will eventually become the butt of someone's joke. Someone who is the target of ridicule and laughter for his or her constant excuses and reasons for his or her unfulfilled life. In a butters person's world, the emphasis is on why they cannot, never did, or should not. Your focus should be on why you should, how you can, and how you are going to, despite any obstacles that may come your way.
Hi, good afternoon, everyone. Good afternoon, and welcome to this week's edition of Make Health Your Habit podcast live. It's really a pleasure to have you guys with me today. Today we're having a subject that is really dear to my heart, and I'll let you know why that is afterwards. But I really hope this Sunday afternoon or even a Sunday morning, because I know we have some international listeners here, is meeting you well. I would like to say hello. So I've seen that Mr. P, our usual, is here. So if you're watching this on YouTube, on LinkedIn, on Twitter, or on Facebook, just say hi. Just say hi. You can use the chat box and just say hi. Let's see where you're calling from. So yes, Mr. P, Pure Butters. I love that. It's always one of those motivational things that I have before the show. So yes, too many butters people chat hot air. Yes, I totally agree with you. So yes, just join us. We have a real interesting subject today. Good afternoon, Joyanne. Or good morning, I could say, because you're calling from the UK. Good morning, Joyanne. Pleased that you could join us today. Is there anyone else there in the land who would like to say good morning or good afternoon? We normally leave this time open for people just to say hi. Again, you could use the chat box on Facebook or YouTube or even LinkedIn to say hi and good afternoon. It's always a pleasure to see who's on board. You know, the weather here in England is quite bright out there today. So it's not snowing like it was last week. Good afternoon, Isaiah, our first international listener. Good morning, I should say to you, because I know you're calling from the USA. So good morning to you, Isaiah. Hope the weather's nice for you. It was snowing last week. What's the weather like this week, Isaiah? I hope it's not snowing too bad or snow's moved away. So, I mean, there have been times we've had listeners from Canada, from Barbados, from America, from Jamaica. It's nice to know that we have an international show. We have a serious topic today. And I'm really hoping this topic will be of benefit to so many people. We've got a brilliant lady who's really passionate about her work, and I really look forward to hearing what she has to say about this subject. All right, so it looks like you're a little bit quiet there this morning, this afternoon. So listen, hold on, it's coming. This week's edition of Make Health Your Habit will come straight after this. Yes, good afternoon and welcome to Make Health Your Habit podcast live. Yes, Joanne, you're in Barbados. I forgot you. You're not in the UK. You're calling from Barbados. And good afternoon, Dunstan, as well. So look, today we have a subject that's incredibly dear to my heart. And that subject is breast cancer. Now, it's not because of I have suffered from breast cancer. It's just that I was with my mother when, she called me one day, said, Ken, you know what, because she used to regularly examine her breast. And then she called me and said, I'm going to have to go to the doctor because I found, a lump in my breast. So I said, okay, then I went with her. So we went and, the doctor said, okay, we'll have to do some tests. So then she went back, did the test. And then I came back with her when she got the results. And I will definitely say to you, when the doctor said to her that she had breast cancer, I saw fear in my mum's eyes. I absolutely saw fear. And for a child to see fear in a mum's eyes, it's never, ever a great thing. And I had to work with my mum through that period of breast cancer. She was too old and a bit too frail to have the chemotherapy, so she had the tablets. Fortunately, it did go into remission, but spending that time with her and talking with her and seeing that fear in her eyes, it must be a fear that so many women have. It kind of gave me an affinity with breast cancer. So I'm really pleased that we're focusing on that subject today. And we have a wonderful and very educated person with us today who's going to come and talk about breast cancer awareness and hopefully enlighten you in some things to be aware of, look out for, and to alleviate some of the fears that some of you may have regarding the subject. So, good afternoon, because you're in the UK, Dr. Seasay. Good afternoon.
Good afternoon, Ken. Thank you so much for having me here. Oh, the story you just told, it's heartbreaking, but I'm so glad that she's doing better.
Well, she was doing better. Unfortunately, she's passed away. I mean, you didn't know that she passed away, but it wasn't from the breast cancer. But she did have the breast cancer, and I went to her with the hospital every time, and I saw the fear in her eyes and the anxiety, and thankfully through some treatments and some other medicinal things that I gave her, it did go into remission. So this is a subject that's quite dear to my heart, and I'm sure dear to many of the listeners here. But before we move into that subject, please just tell us a little bit about yourself, please.
Of course. So I'm Dr. Aziza Sesay. I'm a UK-based GP. I've been a GP for the last almost 7 years. And I have a very strong passion for basically relaying health information because I really do believe that health is wealth, knowledge is power. So I get involved in these sort of things. I also have my own platform, Talks with Dr. Sesay, where I give free health talks through Zoom on different common topics at least once a month. So I'm really excited to be here to relay some information about this topic that is really close to my heart as well. And yeah, I'm just grateful to be here. I hope that you find the information that I provide useful.
So before you talk about breast cancer and the breast cancer awareness, I'm really curious what got your interest in this area? What was it that steered you to be able to study breast cancer and want to raise awareness about breast cancer?
Okay, so basically, being a GP, majority of my patients, usually, often, women tend to go to women, and when it comes to intimate examinations like this, women do tend to see female doctors. So I have seen quite a few cases, and you've seen the positives and the negatives, and also just the fact that it's so common, but it can be caught quite early if we do the relevant checks. It sounds like your mom used to examine herself quite frequently. So that's one drive that I'm pushing for us to examine our breasts more frequently, for us to be more aware of the risk factors and try and avoid or reduce those. And that's why I'm really passionate about it, because I feel like there's so many little things that we can do as individuals to reduce our risks of different cancers, but in this case, breast cancer. And in fact, actually, there is evidence to show that 30% of cancers in the world are preventable just by changing our lifestyle. So, eating more fruits and vegetables, making sure that we're not overweight or obese, exercising, drinking plenty of fluids, and those sort of stopping smoking, not smoking at all, and minimal alcohol. Those little things can help. So, this is why I really push for these topics, because they're things that we can do to try and reduce the risks and potentially save our lives.
Yeah, no, I totally agree with you. And this is what I push for in my practice is about lifestyle changes. And I know in my practice, lifestyle changes can help people avoid cancer and also mitigate some of the nefarious effects of it. But I'm curious, before we move on to breast cancer itself, when I was doing the research, it said about 50% of women in America, and also possibly the same here, don't regularly check for breast cancer. So if it's such a scary condition, if it is something that a lot of women feel anxious about, why do you think it is that women don't always check?
Okay, so I think that there are a multitude of reasons, one of which, a common one, is the fear of the unknown. I think sometimes people are so scared to find something that they rather not know at all. Ignorance is bliss, right? So that's one of the possible reasons that people aren't checking their breasts. And another is we all have quite busy, hectic lifestyles. And I think that people associate breast examination as something difficult to do and it'll take too long and so on. You can't really fit it into your schedule. Another is forgetfulness. It's just one of those things that you don't, unless it's a routine, you're not going to make it a priority. It's not something that you're used to doing, so you're not going to do it. And another reason is just some people are just not aware of how to do a breast examination, and also why they need to do a breast examination and what to look out for. So there's all of those other factors that link into each other. But that's my personal view of why potentially people aren't examining their breasts. So fear of the unknown, a bit of maybe laziness, as well as uncertainty of how to do it, and not having the time and not making it a routine, and finally literally not knowing why it's important.
I can relate to that. I suppose it's some of the reasons why men, when they have to check their testicles at times, they just don't know how. But hopefully today, when I'm not even hopefully, I know today that we're going to help them and we're going to give some advice. Well, you're going to give some advice, I should say, not me, on exactly how to check and why it's important to check and how they can fit that in their routine. So my
Absolutely.
first obvious question to you is what exactly is breast cancer?
Okay, great question. So, breast cancer is basically where you have abnormal cells in the breast, which divide and grow abnormally until they eventually form a growth, which we call a tumor. And that's the lump that we feel. So, in our bodies, everything is meticulously programmed. The cells, we have trillions of cells in our body, and they divide in a programmed manner, right? Sometimes the cells can be damaged, or you get an abnormal cell that forms. And usually, again, the body is very, very good at picking these up and getting rid of them. However, certain things happen, as with life, where these abnormal cells basically miss that checkpoint and they grow and divide, um, so uncontrollably, because they don't have that programming, and eventually, as I say, form a growth and then compress or push against adjacent cells and organs, eventually spread throughout the body. So that's what happens with breast cancer. The cells within the breast divide abnormally and erratically and form the breast cancer.
Okay, that's interesting. How that cancer happens. So there is no difference between breast cancer and cancer in any other part of the body, or is there a particular unique set of circumstances that happen when women have breast cancer?
Not necessarily. Like I say, with the process of cancer, it's just one of those things where abnormal cells form. And there are a multitude of reasons why they can happen or they can be influenced to happen. So you get things like, for instance, exposures to certain chemicals. So, as I mentioned earlier, with regards to smoking, the tobacco and the cigarette smoking is known to be what we call carcinogen. So it causes the cells to divide irregularly, or causes cells to become abnormal. And then you have things like getting older. Unfortunately, as we get older, increases the risk of abnormal or older damaged cells to then divide abnormally. And then we also have genetic factors. So it may well be that you might have inherited a what we call faulty gene, or a gene that's mutated from either of your parents, and that increases the chances of abnormal cells to form. So that's the premise behind cancer in general. Literally, abnormal cells that then divide erratically, and just basically mess up the organized programming that the body has. And then the body can cope. Oh, I'm so sorry, Ken. I can't hear you.
So how common is breast cancer?
Okay, breast cancer is very, very common. It is the most commonly occurring cancer in women. And I'm going to give you some stats in the UK, which is quite scary, and a bit disheartening as well. But I wanted to point out the reality and why it's so important that we continue to have these discussions. So, more than 55,000 people in the UK are diagnosed with breast cancer every year. That is the same as 150 people diagnosed every single day, which is the same as one person or one woman being diagnosed every 10 minutes. That's how common breast cancer is. And in the UK, they say 1 in 7 women will develop breast cancer in their lifetime. Or when we talk about the world, that stat is 1 in 8. So it is quite common, unfortunately. I wanted to point out here, I did say women a lot, but actually breast cancer does occur in men. It's rare. Only 1% of breast cancer is accounted by men. But it's also important to mention because a lot of men don't realize that they can get breast cancer because it's so associated with women.
We just had someone come through on the message to say that that's a shocking statistic, so they weren't aware of how common breast cancer is. I would like to ask about breast cancer during the menopause, because I've read that when a woman is going through a menopause, she's more susceptible to gaining breast cancer. Is there any truth in that?
So it's not necessarily that women who go through menopause are more susceptible. It's more to do with the age that they go through menopause. Okay. So I wanted to talk about risk factors. One of the risk factors connected with breast cancer is sex hormones, essentially. So it's if we have a lot of sex hormones in our body, that increases the risk of breast cancer occurring. Now, obviously, as we go through puberty, that's when we start to get the sex hormones forming in our body. So if we have menopause later in life, then we're exposed to the sex hormones for much longer. So that's what increases the risk of breast cancer. And that's actually the link between menopause and breast cancer. So it's not necessarily that, oh, if you're going through menopause, you are more prone to getting breast cancer. It just is that if you have it at a later age, and you're exposed to sex hormones for longer. So if you go through puberty earlier in life and then you have your menopause later in life, you're exposed to the sex hormones for much longer. And so you're at increased risk of developing breast cancer, unfortunately.
Okay, so since we're on the topic of risk factors, I know there are people who have breast cancer in their family. So, with regards to the BRCA1 and the BRCA2 gene, I wonder if you could speak into that for anybody who has those genes in their family.
Of course. So I wanted to first of all just explain what BRCA1 and BRCA2 meant. So all literally it stands for, the BR is for breast and the CA is cancer. So it's the BRCA breast cancer gene essentially. But the name is confusing because actually those genes help to prevent cancer from occurring. So if there are any abnormalities in the DNA, so on and so forth, they pick it up and prevent further damage from occurring, right? So it's usually people who have the faulty BRCA1 or BRCA2 or the mutated BRCA genes that then are increased risk of developing breast cancer. Okay, so that's the link. If you have a BRCA1 or BRCA2 mutation, and then there's another genetic mutation as well, TP53, then you're at increased risk. But I'm so glad that you mentioned this because yes, there's also the link between if you have a family history. So if you have a close relative, and when I say close relative, first degree relative, so that would be either your mom or your sister or your children or your daughter, if they had breast cancer, then it increases your risk of developing breast cancer by 2 times, right? However, saying that, 85% of people or women who have a family history of breast cancer never get breast cancer, okay? However, and 87% of people who've been diagnosed with breast cancer don't actually have a family history. So I always mention that point just to say that, yes, if you have a family history, you're at increased risk, but it doesn't necessarily mean that you will definitely have breast cancer. And also, if you don't have a family history, it doesn't mean that you're not going to get breast cancer. So it's just something to think about and why it's important to just lead that healthy lifestyle, whatever the situation.
Yeah, I think that's quite reassuring for some people who are watching this who might have a family history of breast cancer, because I know that some women think that that their mum had breast cancer, so they're at high risk. So that was really great. You explained that. So what are some of the other risk factors when it comes to breast cancer?
Okay, so there's so many. So the first one is common sense one, which is being a woman. Unfortunately, 99% of breast cancers occur in women. And also as you get older, so 80% of breast cancer is accounted by women who are over the age of 50. So it happens to more commonly. I'm not saying it doesn't happen to younger women, but it's more common in women over the age of 50. Being obese has an increased risk factor, and that's because if you are obese, you have more higher percentage of sex hormone in your blood. And remember, I said the link between sex hormone and breast cancer, particularly if you have it around your abdominal area. There is a link between that and increasing the sex hormone levels and increasing the risk of breast cancer. And that's much more important in men because 30% of men end up getting breast cancer if they have a lot of fat, if they're obese, and it's mostly predominantly in their abdominal area. So something to think about. I mentioned smoking before and alcohol. They also can increase your sex hormone levels. We've spoken about family history, ethnicity. Now, actually, breast cancer is more common in white people, right? Having said that, it's really important to emphasize that, unfortunately, Black women have usually get diagnosed with more advanced, more aggressive cancer at a younger age. And there's not much understanding as to why that is. I mean, there is some suspicion about, oh, perhaps it's socioeconomic status. It could also be lack of knowledge, maybe that sort of thing. Or it could, whether it's genetic or there's not concrete reasoning as to why. And then some people say, racism and so on and so forth, access to care. But I just thought it was important to mention that. And that's why we, as Black people need to take this seriously as well, and gain the knowledge that's necessary so that we can prevent it from occurring. Exercise is actually good. It prevents breast cancer from occurring, because when you exercise a lot, it reduces the amount of sex hormones in your body. So if you're sedentary and you don't do any exercise, that increases your risk. If you, as I say, if your periods are earlier in life, and if you go through menopause late, so that length of time is prolonged, that increases your risk. If you've had your first child at an older age, again, that increases the risk just by a small amount.
Dr. Seasay, could you just at that point about having your menopause, your periods early, could you just elaborate on that?
Okay, of course, yeah. So women go through menopause, I beg your pardon, go through menarche. So that's where you first get your the first bleed or period. Usually between the ages, on average, 9, 11, 12, and so on. But if you have it, say at the age of 9, right, and you go through menopause at the age of 55 or 56, that length of time is so prolonged compared to someone, say for instance, who had their period at the age of maybe 13, and then goes through menopause at the age of 47. So do you understand what I'm saying? Literally, it's just that length of time that you're exposed to the sex hormones.
Okay, and particularly, is it the estrogen?
Yes,
It's
it's
the estrogen hormone? Okay.
yeah, majority of the time it's the estrogen, but remember there are different hormonal factors, or hormonal sensitivities depending on the type of breast cancer. But I don't want to get too technical. But yeah, that's why I'm just using the broad sex hormones.
Thank you. So you did you have a few more pointers when it comes to the risks you want to share with us?
Yes, so I was just mentioning breastfeeding. If you've never breastfed, unfortunately, that increases the risk. And talking about sex hormones, women who take contraceptive pills or contraceptive hormones are at an increased risk, a small one by 1%. So increases your risk by 1%. But it's just something to be aware of. However, if you've stopped the pill, after 10 years of not taking it, your risk is back to normal risk as anyone else who's not taking the pill. And again, women who are given HRT, hormone replacement therapy, again, we're giving sex hormones, which increases the risk by a small amount, only 2%. But it's just so you are aware that these things are linked in with developing breast cancer.
So there are two things you said I want to pick up on. The first thing is when you said women who don't breastfeed. So you're saying if a woman has a child and she doesn't breastfeed that child, she's at higher risk of developing breast cancer. Is that what you're saying?
Yes, I'm not saying that there's anything wrong with not breastfeeding your child. I know that it can be very, very difficult, and not everyone has the opportunity to breastfeed. However, there is evidence to show that women who've never breastfed have a higher risk of developing breast cancer.
Okay. And the second thing I want to ask you, you mentioned men and breast cancer. So
Hmm.
I know there are some men watching this show today. So
Yeah.
men get breast cancer as well, do they?
Yes. So, as I say, 1% of the overall breast cancer is found in men. Basically, it's not as common. It's very, very rare, and it's because actually, though men don't have actual breast that's protruding majority of the times, some
Some
men
men
do
do.
if they have gynecomastia and so on. But if you majority of men, won't have breast protruding, but all men have breast tissue. So the same tissue that women have within their breast, men will have it usually just behind their nipple, and that's where the breast cancer develops. Now, breast cancer within all breasts, so we have glandular tissue. Okay, so the glandular tissue is what produces the milk, and then you have the milk duct, which carries the milk from the little tubes um, that make the milk out into the nipple. Okay, so that glandular tissue is usually where breast cancer often develops, and in men the milk ducts are obsolete, but and I mean as in they obviously it's not being used, but it's still within just behind their nipple, and that's why it increases the risk of breast cancer developing.
Okay, I mean, that's really interesting when it comes to men and breast cancer.
I think you as a man, if you just press against your nipple, there's
Should I press like this now? Do I just
like there's a bit of like thready hardness.
it feels a bit soft, so hopefully I'm okay. Let me try the other one just to make sure.
Yeah,
No,
always there.
hopefully I'm good. But that leads us really nicely onto the risk. So, what are some of the symptoms that are associated with breast cancer? I know you have provided a really a nice little diagram here that we might be able to go through. So, what are some of the symptoms that people need to look out for when it comes to breast cancer?
All right. Thank you so much for putting the picture up. That's really helpful. So I hope that anyone who is watching this live can see the image on the screen. So essentially what we're looking for, there are multiple different things. We're looking for a change in the size or the shape of the breast. If you notice there's a lump or an area that feels thicker in your breast, and also maybe a change in the skin texture. So sometimes what can happen is dimpling. So the peel of the orange, how it has little holes. The breast can start to appear like that, and that's usually a sign of cancer. Or if you have a persistent redness or persistent rash around your breast, it's just not going away, and around your nipple, again, that could be a sign. If you notice that your nipple is inverted, so if it's going inwards, or maybe it's changed directions in how it used to point, or just changed its shape, then again, that could be a sign. Now, with regards to inverted nipples, some women or even men are born with inverted nipples, and that's normal for them. So with all these things that I'm mentioning, if this is something that's completely new that you've never had before, you've not been born with, then we get really concerned. If you start to notice liquid or discharge coming out of your nipple, and you're not breastfeeding or lactating, again, that could be a symptom or a sign. And if you are getting persisting pain in your breast or your armpit, and it's going on for weeks and weeks, you've taken simple painkillers and so on, it's not going away, then it's something that we need to look into. And finally, if you notice any lumps in your collarbone, just above your collarbone or even below, or in your armpit, that again can be a sign of breast cancer. And that's because we have lymph nodes that the breast drains into, and the clavicle, sorry, our collarbone, and in the armpit as well.
So, would these symptoms also apply to men and breast cancer?
Yes. I mean, obviously, some of them are not as obvious with regards to change in breast size and so on and so forth. But yeah, pretty much. And this is why we also encourage men to examine their breasts. So when we talk about breast examination in a minute, I would urge both men and women to examine their breasts, because again, even though it's rare in men, you're better just checking. I always say when it comes to screening, that is our own free personal screening tool that we can do ourselves, in our own home without any equipment, and it shouldn't be painful. So that's why I keep encouraging it, because it's not even a hard thing to do, and you'll find out in a second.
So that leads us really nicely onto the question. What is an effective way for someone? Primarily, we're talking about women here because it's only 1% of men. What is an effective way for women to test for breast cancer?
Okay, so breast examination is the very first one that I will push and emphasize. Now, with regards to breast examination, how it works, there's so many different techniques, and if the basis is what's important. Okay, so I hope you can all see me on this screen.
I'm gonna remove this here so they can see you a lot more clearer now. Okay, the presentation.
Yeah. Okay. Well, yeah. Okay. So we'll try and do the best that we can. So when you begin the breast examination, the first thing you need to do is take off your top half completely. So that's your top, your bra, everything. So you're completely naked on your top half. And then you stand and look in front of a mirror, okay? And that's where you're looking for the changes that I just spoke about, whether you notice any change in size or shape in your breast. I mean, some people have different size breasts, and that's normal for them in the long term. But if you notice that something's changed, where one breast has definitely gotten bigger compared to the other, then that's something to be concerned about. If you notice any rash, any lumps or bumps or so on. So you be looking at yourself front on with your arms in 3 positions. The first one is with your arms on the side like this. Okay, just looking forward. The second one would be with your hands on your waist, and then you can press against your waist just to see if there's any breast tissue or lumps that become obvious when you're pressing. And the third position would be your arms up over your head like this. And again, it's just to check for all the changes that I mentioned, see if there are any lumps. You can lean forward as well, because sometimes that makes the lump more visible. And you can turn to the sides, and again, just check to see if you can see any skin changes, any lumps or bumps.
So this is a visual examination, what you're saying, and you're saying
Yeah.
the way you position in your body will help any lumps to protrude out. Is
Absolutely.
that okay?
Absolutely. So the first step is always looking. Okay. So after you've done that, and take your time doing that, but it shouldn't take too long, especially if you're used to doing it quite frequently, because then you'll know what your normal looks like, and you can pick up abnormal very quickly because you know what it looks like. It's already, fixed in your mind. But take your time. And then the second thing that you do is you feel. Now, feeling you can either do lying down, or you can do whilst you're in the shower, and the soap often helps just to make it smoother as you're examining, as you're feeling. So what would happen is you would use the flats of your 3 fingers. Okay, I'm showing on the screen. You want this area to be the area that you're pressing against your breast, and then one arm above your head. So if you're going to examine your right breast, you have your right arm up, okay? And what I always say is you divide your breast into 4 quadrants, okay? Or 4 parts. 1, 2, 3, 4. That way you can do a focused examination of those 4 parts, okay? And then, like I said, with the 3 fingers, you will then do a circular motion from the nipple, and then you press, right? And you press that, examine the 4 areas. And I'm just going to start with here. So then when you get up here, you're pressing, you're really pushing down. And then you make sure that you press the shoulder tip area. Don't forget that area. And then you press your collarbone, underneath your collarbone, above your collarbone as well. And then you make sure that you're checking the center of your chest as well, all the way down. And very important to check inside your armpit as well. You press down into your armpit to make sure if you can feel any lumps or bumps. Okay, and really just keep pushing down to try and see if you can feel any lumps. And if you do feel any lumps, always compare it to the other side. Always examine the other side as well, because it may be that a lump that you think may be abnormal on one side is actually just a normal variant for you because it's there on the other side. But if you do find a lump, or if you notice any skin changes, and you're concerned, then I would really encourage you to please, please, please go and see your GP. And I encourage women to see their GP to get their breast examined by us, just in case. If there's anything that you just feel isn't right, trust your gut. We'll examine you, we'll assess you, and we'll either reassure you or we'll refer you to the breast clinic so you can get some further examinations done. But that is literally it. It's not hard. I reckon it would take at least, 3 minutes altogether, maybe 4, but definitely under 5. So I hope that you find that useful. That's just one technique and one example of how to examine your breast. But you want to make sure that you are looking with your arms in the 3 position in front of a mirror. And then when you're feeling, you really want to make sure that you feel every aspect of each breasts. And you don't forget the shoulder tip. You don't forget above and under the collarbone. You don't forget the middle zone of the chest. And you don't forget the armpit.
So what I'm getting from that is a lump could be in the breast itself, but also under the armpit, and that could be also breast cancer, even though it's away from the breast under the armpit. Is that correct?
Yes, and that's because of the lymph nodes. So, lymph nodes, we have loads of lymph nodes in our body, and they drain fluids and so on. And essentially, the breast tissue, often the breast area, they often drain fluid into the lymph nodes or lymph glands of the armpit and the collarbone area, and also in the mediastinal area. So this center area, we have nodes there as well. So if cancer develops and it spreads to those nodes, then that's where the lump forms. And this is why I say, or it's actually advised that we examine our breast at least once every single month at the same time.
I was about to ask you that question.
Okay. Yeah, so do it at least once a month, every month at the same time. And it doesn't have to be a specific day. However, there's a push called Feel on the First, where we're trying to encourage every woman to just feel on the first. It's like a reminder. It's the first of the month. The first thing you do is feel your breast in the morning, right? Or in the evening if you want. Just that way you don't need to set a reminder. It's a routine, as I say. You don't need to think about it. Oh, it's the first of the month. I need to examine my breast. Or even there's some amazing apps that then send you a reminder on the first of the month. And I think it's Feel on the First or Cup of Feel as well. They send you a reminder to examine your breast if you forget, or you can set a reminder on your phone. So every single month on the same day, you examine your breast. Often they say do it after your period, just because during your period or just before your period, the breast can be quite tender and a bit engorged. But again, as long as you do it once a month at the same time, then you should hopefully be able to know what's normal. So that's what I'm really pushing for. You know what's normal for you. So then it's so much easier to pick up what's abnormal, particularly the smaller changes, because you've done it so many times. You won't dismiss it because it's like, that was definitely not there, the last few months. So this is new. I need to get it checked out.
So once a month. Is there any difference for lactating women? Did they have to do any other special tech, or is it exactly the same?
It's pretty much the same. It's just, I guess, what you need to remember, what lactating women need to remember is the breasts are going to be fuller and more sore. So the advice often is that you examine after a feed, because then hopefully the breast isn't as engorged and not as tender. And the same thing, you do the same thing. Women may find that yes, there are probably more lumps and bumps, and sometimes it's because of blocked duct. So what we often encourage is that you massage that lump often and so on. And if it's not going away, after a few days or a week or so on, and you're still concerned, then you can see the doctor. And women who are breastfeeding can also develop mastitis. So where they do get the lumps, but that's often painful, and the breast itself is quite red and hot, and that can be treated often conservatively. So again, massage and warm compress and that sort of thing. But if it's persisting, then they'll need antibiotics. So that, I guess, that's a difference with lactating women. Just to remember that the breast examination may feel a bit different and maybe a bit more tender, but it's just to be aware of other potential causes of lumps in women who are lactating compared to women who aren't.
So just a couple of points to cover on that point. You said if they use soap, or can they use oil to make their hands? So just to make it a little bit more smoother, is that you're saying? On the
Yeah, I mean, they don't have to. It's just that when you're in the shower, it just makes it much more of a smoother examination. You don't have to, but if you want to, then by all means.
And just the last question on that. So we know the frequency. The frequency is once a month.
Yeah.
But if they want to do it regularly, then that's their choice. So a breast examination, how long should it last? So you're saying 5 minutes on each breast, or 10 minutes? So because we don't want people to rush it in a sense. So how long would you say a breast examination session should last?
Yeah, as I say, it varies. Again, we need to remember that women have different breast sizes. So a woman who has a smaller breast size will probably not take as long as someone who has a bigger breast. I don't want to quantify a time. I would genuinely just say, take your time and really take the time to look, take the time to feel, and as long as it needs to be. I did say perhaps it would take about 5 minutes per breast, but it's individually based. So I don't want to, stringently say, oh, you have to take 10 minutes when actually it might not be that long for the individual. But I would say this is for your own health. So take the time that you need to ensure that you do a proper examination.
Okay, thank you very much for that. So listen, so there's a scenario, maybe like my mum, she's done the breast examination and she's found a lump, or she's found something that concerns her. So the next step, I'm guessing after that, is screening. Would that be the next step? She would go for screening?
No, no, no. So screening is done to apparently healthy individuals, so people who don't have symptoms. And it's just a government program that's available for women between the
Okay.
ages of. Okay, yeah, we'll talk about screening. Yeah.
Yeah, so I just thought, I'm learning here. So
No, of
screening
course.
is not something you do when you find like it's you do it before.
Yes. So
Okay.
screening is done in women, or screening in general is done to people who are apparently healthy. So we're assuming that they're fine, they don't have any symptoms, there's nothing wrong with them. And what the aim is to try and pick up cancer either early. In breast cancer is to try and pick it up early, but in with some of the other cancer screening pathways, it's also to prevent cancer from developing. So when it comes to breast cancer screening within the UK, because I know in the States and different areas, the age range is a bit different. Women between the ages of 50 to 70 are invited for their breast cancer screening. Now, I have to say that in some places in England, the age range is between 47 to 73, but majority is 50 to 70. They get invited as long as they're registered with a GP. So again, it's just a push to please register with your GP if you're in the UK. Every 3 years to have a mammogram. Now, that's what the picture on the screen is showing. That's basically what the equipment looks like, and that's exactly how the woman would be placed onto the device. Now, essentially, what a mammogram is, where they take two X-rays of the breast. So they'll take a picture of the top of the breast and a picture of the side. So the machine, you can see, has two plates that are like this, and the breast is put in between. And what happens is the plates squeeze down on the woman's tummy so that they can breast, so that they can take the images of the breast tissue, and then it moves up again, and the device is then moved to the side so they can take the side view of the woman and pressed again. Um, and that's how the procedure is done every 3 years if it's all normal. And often that's where they pick up little changes. The reason it's done after the age of 50 is because, as I say, 80% of cancers occur in women over the age of 50. And also mammograms they're not as good as picking up breast cancer, or they're not as good as getting much imaging of the breast if women have really thickened breast tissue, and that's usually the case in women under the age of 50. So
It's not this process for any woman who hasn't had it. It's not a painful process in any way.
to be completely honest, I'm not going to say it's not painful, because I've had patients who have said it's been quite uncomfortable, and some have said it's painful. It can be quite uncomfortable because yes, it's two plates that are pushing down, quite deeply, but it only lasts, a minute, if that, for each of the imaging that they need to take. So I often say, yes, it is painful and it's uncomfortable, but it's for a short period of time. And actually, if they pick up the cancer earlier, then your prognosis is much better. So your survival is much higher. Actually, in fact, I have a statistic for that. 98% of women who are diagnosed with breast cancer early will live more than 5 years.
Right.
Okay. Compared to about 26% of women who are diagnosed at the later stages who will live 5 years or more.
Could you just give us an
So
idea what late stage is? Is it stage 3? Is that a late stage?
So when I say late stage, I mean a cancer that's basically advanced, essentially one that it has spread. So when the person get diagnosed with cancer, they then go through the staging pathway, and this is where they find out the size of the cancer itself, whether or not it's spread to different areas. So they check the nodes, different areas, so different lymph nodes. I beg your pardon. So whether it's spread to the armpit lymph nodes, the mediastinal, so the chest lymph nodes, or the clavicular lymph nodes area, those ones. Then they also check whether it's spread to distant parts of the body, to the brain, or the liver, and so on and so forth. So women who are at the later stages, so where it has spread to the lymph nodes and distant organs, they will have a lower survival rate compared to a woman who just has small breast cancer that is localized in the breast and hasn't spread anywhere else.
So the moral in the story is get checked.
Pretty
It's
much.
like a man with prostate cancer. Just get regular checks. It doesn't matter how uncomfortable it may be, because I remember in the prostate cancer before you used to have the PSA, the blood test, men wouldn't go because it was uncomfortable, and mortality rate was high. And I suppose that is the same with women. Just get checked.
Absolutely, yeah. That's why we're having this discussion, and we're really trying to push for people to go for the screening. And in the UK, it's free, so
Yeah.
please do try to attend. So mammogram is one of the other ways to screen, and then there's also MRI scans that are done. I know I mentioned age range for when it's done. I need to also mention that women who are in the high risk group. Oh, MRI scan. Okay, let's talk
Yeah.
about the MRI
I was
scan
just
quickly.
gonna come to that. You beat me. You beat me to it. Okay. Go ahead. Yes.
I'll stop talking.
No, you're good. Good. So from what I'm gathering, this is something for women who may be a bit of a higher risk. Is that correct, or is it just a different, a more of a deeper scan?
It's a different type of scan altogether. So that's MRI, magnetic resonance imaging, where they use magnet essentially to get imaging of the breast. Mammogram is actually more sensitive than the
Oops,
MRI scan.
my
MRI
apologies. Let
scan.
me come back.
Oh,
I
that's
went there a bit too early, but go ahead.
So MRI scan is often done in women who are younger, and also if, say, for instance, a woman has done the mammogram and they think they found something abnormal, they may then have them go for an MRI scan. So this is what the device looks like. If you're looking at this screen, essentially you will be positioned the way this lady is. So you'll be face down, and then it's a big machine, and you go into essentially like a tunnel, and then you're there for a short period of time where they can get the imaging of the breasts. Now, some people do find MRI scans a bit scary because they may be claustrophobic. But I was also mentioning that an MRI scan is another option, is another screening tool. And the reason I mention it is because in women who have a higher risk of breast cancer, so women who have a family history of breast cancer, they are encouraged, and I want to get the age right, I don't want to, yes, they are encouraged, if they are over 40, they are encouraged to have a mammogram every year. Okay. And when they're under 40, then they need to have an MRI scan every year. Okay. Between the age of 30 to 40. So these are high risk women. They get screening done earlier. And then women who have the gene mutations that we spoke about, so the BRCA1, BRCA2, or TP53, they will have the MRI scan done a lot earlier. Actually, they in women who have the TP53 gene mutation, they have to have an MRI scan done every year from the age of 20 until the age of 40. Then they have a mammogram every year. And then women who have the BRCA1, BRCA2 mutations have to have an MRI scan done every year from the age of 30. So it's just to mention that though the screening program says 50 to 70, women who are at higher risk actually get screened much more frequently and much more earlier.
That is incredibly interesting. Look, I just want to encourage you, if you're watching at the moment, if you have a question for Dr. Seasay about breast cancer awareness, she's been very detailed in raising the awareness about breast cancer and what to look out for. But I know I've just seen June. He said her mum had breast cancer in her 30s, so she has a mammogram every year. So from she turned 40, she said she has a mammogram every year because her mum had breast cancer in her 30s. So if you have a question for Dr. Seasay, just use the chat either on LinkedIn, Facebook, anywhere you are now. If you have a question for Dr. Seasay, just use the chat and we'll see if we can get that answered now. So I really, really appreciate your knowledge in that. I mean, it really comes to the very similar to men. Get checked. There are lifestyle changes that you can make to avoid. If you're putting on weight, then obviously that's a risk factor. And I suppose that leads into what I do, which is about helping people lose weight through sugar reduction, because obviously too much sugar can obviously lead to putting weight. So there are things that we can do and women can do to help themselves when it comes to breast cancer. And we're going to continue that conversation in a moment. There may be some questions that will come up in the meantime. But for the moment, we are going to play the Sugar Smash game. Because we're talking about sugar. We were just speaking about sugar just then. And our sugar, sugar feeds on yeah. Someone said, can a change of diet help? We're going to go into that. We're definitely going to go into that. So, sugar and cancer really, really don't go together. So my whole being is about helping people to reduce sugar. But most people are not aware of how much sugar is in their food. They know about table sugar, but they don't know that sometimes when they're eating a crispy donut, that's also sugar. When they're eating rice, it also turns to sugar in their body. So this is called the Sugar Smash. And I'm going to present 3 foods, and you're going to have a little guess with me at the amount of sugar inside it. So let me show you how it works, all right? So our bodies have approximately 1 teaspoon, 1.5 teaspoons worth of sugar in it at any one time in the form of blood glucose. That's about 4 grams of sugar. So every teaspoon in this game equals 4 grams of sugar. All right. So as I like to let people know, there are 2 different types of sugar that our bodies ingest that turn into. One is fructose. You see the banana at the top. When we eat that, that turns to fructose. But the bread, the rice, and the pasta, that turns to something called glucose. And they're all different forms of sugar. And too much of those sugars, even though they're not table sugars, people may think natural sugars, can lead to nefarious effects with our health. So my protocol says, depending on your carb tolerance, that you may have to reduce the ingestion of refined carbohydrates and even sometimes complex carbohydrates even more, because they lead to weight gain. That's what they lead to weight gain. All right. So as Mr. P said, it feeds on sugar. So I have 3 foods here. So the first one is, this is low fat. Yeah. This is story-filled organic low fat yogurt. So there are 3 options here. It either has A, 8 teaspoons, B, 12 teaspoons, or C, 14 teaspoons. Now, look, if you're watching on YouTube, Facebook, you can guess. You can say A, B, or C. So, how many teaspoons do you think is in this low-fat yogurt? Maybe it's low-fat. It's healthy. It's supposed to be healthy. But how many teaspoons of sugar? So, why Dr. Seasay has a guess? Last week, it was 2-1. I lost that game. So what would you call? Would you call A, B, or C? And again, if you're on YouTube or Facebook or LinkedIn, have a guess with us. So, we've had the first guest come in. We've had B. Miss, I have to say 18 says B. Are we having any guesses? Are you ready to make your call now? Dr. Seasay, what do you reckon? Is it A? I mean, don't worry if you get it wrong. I didn't know some of this before I'd done research. We've had C come in. We've had an A come. So we've had B, C, and A. So Ruby said A, DJ Mr. P said B. What are you going to call? Baby I said A. What one are you going to call? Come on, make a call.
Like it might be, it's between B and C, because I think it's a trick question. Low-fat foods often have a lot of sugar in it.
Okay, so let's see. Which one are you going to call?
Let's just say B.
We're getting a lot of B's coming through. Make a call, Dr. Sesay. Come on.
Yeah, let's go with B.
Are you going with B as well? So let's smash this and see how this looks. Yes, and it is. Oh, B. Well done. Absolutely well done. For all of you who said B, absolutely well done. And for everybody else, unfortunately, you know, it's just the way it goes. But well done, Isaiah. Well done, Primrose. Well done, Miss 18. And well done, Anne-Marie. You said B. And well done, Seasay. You got that. You, Dr. Seasay, you got that one right. So here's one more. Look, this is soup, man. This has got to be healthy, man. This is soup here. This is from Eat. This is an autumn squash and maple soup. I mean, I used to buy this before. I love soup. It keeps you warm in the winter. So we got 3 options. Come on. Let's get your numbers in. Is it A, B, or C? So it's A, 9 teaspoons, B, 10 teaspoons, or C, 11 teaspoons. Come on, you guys. Got this first one right. Let's see if you can make it 2 out of 2 while Dr. Seasay has a thing. Remember, this is soup here. All right? This is soup you buy from Eat. This is a healthy shop, but which one? Just have a think. Would you A, B? So we've had a couple come in. We've had C come in. Primrose has said C as well. Ruby has said B. Anne-Marie has said C. Great. We're getting some answers coming in from YouTube. Definitely. Anything coming in from Facebook? Are you going to make a call, Dr. Seasay? Because you're one up now. Because come on. Which one you going for?
I'm looking at the squash and the maple aspect.
Okay, you're trying to make a logical judgment assessment here.
And actually, soup has carbohydrates in it, and it looks like they're. I don't know. Let's go with C.
You're going with C. So
Yeah.
C, we're going. Joanne is coming with C. Okay, so let's see if it's 2 out of 2 for you. Let's smash this soup and just see how many teaspoons is in this soup.
Oh, okay.
9 teaspoons. Well, you look like. Where we go? So Ruby, well done, Ruby, and DJ Mr. P. You're on form today, Mr. P. Mr. P has been beaten up a few times. But for those who said A, well done, and for the rest of you, including Dr. Sesay, yeah, that's it. So we have one more. So it's one more. We have this Red Bull now. We have a can of Red Bull. So these are the options. We have A, 7.25, B, 9.25, or C, 11.25. Are you going to call it? Mr. P, are you going to get 3 out of 3 this week and redeem yourself? Because you've been getting beaten up for a while. So is it A, B, C, or D? Let's have your answers on YouTube or Facebook. What is your answers? While Dr. Seasay looks and she decides which one... It's 1-1, remember.
Red Bull is bad. Like
this is 1-1. This might be an easy one. So we've had a full house with C at the moment. Yeah. People are not liking this Red Bull. I mean, maybe I can't even remember what I said. I can't remember what it was, but maybe I made this one a bit too easy for you guys. Next week, but I can't remember. It may be C, it may be B, but it also might be A. Call it, Dr. Seasay. Which one are you gonna call?
I feel like worst. I think it's the worst one. So C.
Wait, it looks like a full house of C. So let's smash this Red Bull and see exactly how many teaspoons in this Red Bull here. Oh my gosh.
Okay.
That was a trick question for you guys. Yes. And I think that goes to everybody. I knew you guys were going to go for the C. I absolutely knew that. Look, Mr. B, he's so funny. So I got one right. So it looks like 2-1. Last week, the guest it was 2-1, and this week it was 2-1 to me. Listen, Red Bull's bad for you anyway. Look, it's still 7.25 teaspoons of sugar. I mean, the average doses a man is about 6 teaspoons. So if you drink one of these one Red Bull, and I see some people drink 2, 3 in a day. Red Bull is really, really bad for you, but it has a lot of sugar in it. And this game is just to show people the amount of sugar, the hidden sugar in their food. Sometimes it's infused, like in Red Bull, but last week we done things like rice and bread. Those things are still sugar. So if you have a problem with your blood sugar, reducing those refined carbohydrates can help you. And this game is just about an awareness. So you decide if you want to drink Red Bull or April Maple soup or anything. But this game is every single week I present 3 foods which will just bring some awareness to the amount of sugar in your food. And we're talking about cancer today. And sugar and cancer is something that should really go together. So I suppose it's apt. And I'm sure anybody, someone asked about lifestyle changes, and I'm sure reduction in sugar is one of them. So I am just for the moment, I'm just gonna if you just bear with me, I'm just gonna share with people a couple of things. If you like the fact of eating some reduced sugar foods, then if you go to my website kenmbarnes.com, up the top you'll see free meal plan, and what you can do, you can download a free 5-day recipe. These are sugar free and reduced Caribbean recipes. Not all of them. Well, there's at least 2. There's curry salmon, as you can see, and jerk chicken with my own jerk sauce. But these recipes won't raise your blood sugar. These recipes are what I prescribe to my clients. And you can see how you can eat delicious food, low carb food, which is not going to be nefarious to your health, which is not going to affect your health. And even if you did unfortunately suffer cancer and you was asked to change your diet, then you could still eat these foods. So go to kenmbarnes.com, go to the top, it says free meal plan, and you can download that absolutely free of charge. And it's got like shopping lists and a meal plan and what to do with leftovers. People have really loved it. So just visit kenmbarnes.com and you can download that. I just want to tell you that I'm having a program coming up soon called Pre-Diabetes Defeated. It's my program, which I do in a 1-to-1, but I'm actually doing a group program. That program is starting April the 3rd. I'm going to tell you more about that next week. Next week is all going to be about pre-diabetes. And if you're suffering from pre-diabetes, how you can reverse it naturally in 30 to 60 days. That is what we are going to be covering next week. I've got an excellent guy who's 62 years old, and I'm forming a great friendship with him. And he's going to be talking about how we reverse pre-diabetes, in a short time. And I'll be sharing my story. So if you have a history of pre-diabetes or even diabetes, you need to watch the program next week. And remember, pre-diabetes leads to diabetes. Yes? So it's not something you should ignore. Don't think it's not dangerous. It is something that you should take in consideration. So that program is going to be starting on the 3rd of April, and I'll tell you more about that next week. And if you're watching this on YouTube, look, just subscribe to the YouTube channel, like this video, bit of love, and just share the video, because I think Dr. Seasay shared some excellent information. Just share the video on YouTube, share it on Facebook, all right? So we will be here every single week on a Sunday. So Dr. Seasay, bringing all that together. I mean, I think one of the things that's really, really been clear in what you're saying is about lifestyle changes as a preventative measure. We haven't really talked about if someone has got cancer, breast cancer, because this is really about breast cancer awareness. And we spoke about the building that routine of checking in every single month. So if you was to summarize in maybe 3 or 4 ways this conversation, and you wanted to leave the audience with someone, I know someone actually did mention about lifestyle changes. If you were to summarize that and you wanted to leave the audience with 3 or 4 points that they really want to take away, what would those 3 or 4 points be?
Okay, so the first one would be know your body, know what's normal for you. And this is where we push to do the self-breast examination, because nobody will know you better than you. And if you are more familiar with your body, familiar with what, how it looks like and what it feels like, then you'll know if there are any abnormal changes. And I mean this with anything really, with regards to know what your stools are like, know what your urine looks like, and so on and so forth. If you know yourself, then you'll know when things aren't right. So that would be my first take-home message. Then the second would be, please don't be afraid to seek help if you are concerned about something. If you find something and you feel in your gut that something is wrong, seek help. And if you feel that you weren't listened to, seek help from someone else, get a second opinion, because ultimately I do believe that our gut is really important that we follow it, because there have been times where unfortunately patients have been concerned about something and it was missed because they didn't go back and get checked again. So I would always say, seek help and support. And if you're still concerned, then always go for a second opinion. There's nothing wrong with that. And I won't be offended if you did do that. But I have a very low threshold for referring people if they're concerned. And finally, the most important point, as I mentioned earlier, 30% of breast cancer has been found. It has been found that 30% of cancer can be prevented just by changing our lifestyle. And this is eating more fruits and vegetables, making sure that we're not overweight or obese, making sure that we're exercising, that we're not smoking at all. There's literally no benefit to smoking. So if you do smoke, then please stop. And minimizing the alcohol intake. The recommended amount is 14 units for both men and women per week. Or don't drink at all. It's entirely up to you. I mean, different people have different views when it comes to alcohol, but making sure that you minimize the amount of alcohol. And yeah, that's basically what I would say my take home is. Know your body, seek help and guidance, seek a second opinion if you have to, and just lead that healthy lifestyle. Keep listening to Ken because I think this is brilliant.
And that advice goes to men as well, because the 1%. I didn't even think men would come into this, to be honest with you, but you mentioned it, and it's unfortunate that someone watching this could be in that 1%. And absolutely,
yeah, absolutely. And then with regards to women in the UK, 1 in 7 women will be diagnosed with breast cancer.
Yeah.
1 in 7, and in the world, 1 in 8, which is scary. So let's try and pick up the cancer earlier. So even if we are diagnosed, it can be treated.
Absolutely, and that I was really shocked about that, the rate of women that don't check. So let's hope that every single woman here now adopts a regular routine to check her breast. And I would advise you, whether you share the video or not, please share this information with your friends. Have a discussion with your friends. And the thing about having a discussion, it kind of indents the information in your mind. And say, I watched this really great podcast. I hope you think it's a really great podcast, because I do, and I know Dr. Seasay does. And say, look, they were talking about breast cancer, and they were talking about the awareness and how often we have to screen, and this is what we've got to do. And if you actually share it with a friend, it actually indents that information in your mind. And it's an important thing. And as I said right in the beginning, I have a personal perspective on this, because as I said, the look on my mum's face when she found the lump, it was a little bit nonchalant, but I think she was wise enough. But when the doctor told her she had breast cancer, she had hold of my hand, and I felt her squeeze my hand so hard, and I looked at her and I saw the fear in my mum's eyes. But fortunately, she went early and they were able to treat it. Had she ignored it or not been aware and checking, as Dr. Seasay said, it could have really been gone to a more advanced stage. So ladies and gentlemen, please follow the advice from Dr. Seasay. She's given some excellent advice and some simple advice. There's nothing complicated about what she's given. She's just given some simple advice to help you manage your health and your lifestyle better. One last question before you share where people can contact you. Someone's asked, are you from Gambia or Senegal? I don't know if that's a relevant question, so I'm asking it. Yeah. They've asked that question.
It's fine. I am West African, but I'm neither of the two. I'm Sierra Leonean. I'm from Sierra Leone.
So there you go, Mr. DJ Peter. So Dr. Seasay, if people have listened to you and they thought, right, some great information, I really connect with that doctor, and I would like to be able to find out more, where can they reach out to you? How can they contact you?
Thank you so much for giving me the opportunity to tell them. So I am on Talks with Dr. Sesay. So Talks with an S with Dr. Sesay. S for Sierra, E for Echo, S for Sierra, A for Alpha, Y for Yankee. Talks with Dr. Sesay on Instagram, on Facebook and on YouTube. I also have a YouTube channel, and I have done a presentation on breast cancer screening. So if you want to just recap as well, I mean, it's a different format because it's a presentation, and by all means, please do. There are other videos on cervical cancer screening, sickle cell, so on and so forth. And as I say, if you would like to join the free Zoom talks, go to our website on www.talkswithdrsesay.com, and you get regular updates on when the next session is. And like I say, it's free. It's all about giving the information out there to our people, because knowledge is power, and just making small changes could really save your life.
Please
But
just repeat your
I hope that you
website.
do follow. Oh, and Instagram as well. I don't know
Yeah,
if I.
that's right. No, please repeat your website again, just a little bit slower, because they can
Oh,
see Cece, and also how they contact you on Instagram. And also you have a Facebook page as well. So please give them those
yeah.
details as well.
So it's Talks with Dr. Sesay on Facebook, on Instagram, and on YouTube. If you type Talks with Dr. Sesay, and my surname is spelled Sesay. And the website is www.talkswithdrsesay.com. And if you want to email me, you can. It's drsesay101@gmail.com. Dr. Sesay, Sesay 101@gmail.com. But you can, if you go through the Facebook, you can reach me that way as well. Facebook, Instagram, and so on.
Well, Dr. Sesay, I really appreciate you taking the time out. I know you're recovering from the dreaded virus, just like myself. And I really appreciate you taking the time out, because I know this information was valuable to some people. So I really appreciate you taking the time out today to join us. I think you were wonderful. I think people will be able to relate to you, and I think the information was clear and knowledgeable. So I really hope people have taken away the messages that you're given today. So I really do appreciate that. So thank you very, very much.
Thank you.
I'm gonna just place you in that green room in a minute, and then I'll be with you in just one moment, right? But thank you on behalf of everybody who's watching for taking the time out today to come and share your information. Okay?
Thank you all
very much. Lovely. So, ladies and gentlemen, there you have it. Another edition of Make Health Your Habit Live. I didn't actually say it at the beginning, but my business, I'm a health coach. I'm the creator of the Lean Mind Body Method, the simple science of getting lean, fit, and healthy. And that methodology helps people to be able to lose weight and control their blood sugar, and so much more. If you'd like to find out anything more about what I do, just go to kenmbarnes.com and you can find out more about what I do. And also, if you just wanted to reach out to me, you can email me at ken@kenmbarnes.com. If you were interested in the pre-diabetes boot camp or any kind of coaching, or I do offer some consultations. You can just talk for 15 minutes and I'll do a consultation. You can find that all on my website at Ken M. Barnes. So just go there, take a look, and you can see what I do. And there's so much more coming in the future. And again, if you want to contact me. But we're here every Sunday, and we cover a wide spectrum of health, not just my protocol. As I said, next week is all going to be about pre-diabetes. If you suffer from it, if you're worried about it, please join the show. I mean, I reversed my pre-diabetes, and I'm so happy. High blood sugar affects every single organ in your body. And just to show you the severity of it, in men, it can even make you impotent. And in women, it can even affect your ability to have an orgasm. Yes, that is. And if that's not a reason to be concerned about high blood sugar and pre-diabetes, what is? I'll definitely. So, and I'm going to share that with you. We're going to go deep next week. Next week is all about pre-diabetes. So I really hope you join us. The Sunday, I do like the Sunday time. We've moved it from a Monday to a Sunday. I do like it. It's brighter outside. And I know some of you are going to go and now do your cooking, your rice and peas and your chicken. I'm having fish today. I'm having steamed fish. A little bit of soy sauce with some spring onions, and then some cauliflower rice. That's my low carb meal. That's what I think I'm going to have today. Nice and easy today. So listen, so whatever you do, enjoy the rest of your Sunday. If you're watching us from overseas, we thank you for your time. We really hope today has been of value to you. And we really hope that, you've enjoyed the show. Thank you very much again to Dr. Seasay. Let me end by also saying thank you to Annika, who was here last week and spoke wonderfully about living a plant-based diet. Thank you, Annika, for giving up your time. So, ladies and gentlemen, next week, I will see you on Make Health Your Habit podcast live. Thanks for listening to the Make Health Your Habit podcast live show. Remember, the views and opinions expressed during the show represent those of our guests and host alone. We hope you enjoyed the show.